Welcome to Recovery Reach by Recovery.com, where we talk with marketing and business experts in the substance use and mental health treatment industry to help grow your organization's impact. Because the more people you reach, the more people you can help. From alumni beach parties to high-impact CE events, Renee Baribeau has done it all. The longtime event director behind Montare and Renewal Health Group joins us to share how strategic, soulful gatherings can build community and fill beds across the behavioral health landscape. Hello, everybody. Welcome to another show. We have Renee on the seat today, Renee Baribeau. Renee, who are you? What do you do?
Who am I? That would take a lifetime to explain, but what I currently serve is Montare Behavioral Health and Renewal Health Group as the event director. And I am also a Hay House author, so I also do author kind of events and things like that.
I love that. Yeah, and you are here today to talk to us all about events.
Mm-hmm.
I think even one of your job titles, if not now, in the past, I mean, you were doing marketing and outreach and events.
Mm-hmm.
So kind of a Jane of all trades. And I'm really interested to hear kind of how events overlap and pull resources from and benefit all of these different aspects of a treatment facility. But I guess first, just to set some foundations about what we'll talk about, when we're talking about events, what kind of events are we specifically talking about, or are you specifically talking about?
Well, Andrew, that's a really interesting question because I think it's all of those events. You know, I've been responsible for online CE events. When we were talking about COVID before we hit record, and during COVID, I spent a lot of time teaching other business development people how to use Zoom because at that time people were not Zoom friendly, and so I think that a lot of networking that was in person has gone to Zoom, and hopefully now it's going to step back off of Zoom and back into in person. So I think what we'll concentrate today is how we can make an events a good part of our ROI and our business structure.
Yeah. And what are the benefits of doing events, both at the smaller scale, kind of local community events, to participating or hosting larger national events?
Well, two things. We're social beings, and people really like to be social. And if you studied men on the golf courses in the 60s, 70s, and 80s, people do business with friends. And I think that that's still true today, that you call, like, people that I get to know are probably the people who are closest in my, digital Rolodex.
Yeah, that's true. I felt, especially in this industry, I've had my hand in a couple different industries, and this one, events, person to person, interrelationships, seem crucial, which is probably not a surprise to any of our listeners. But the second thing I want to note with events is, are there ever any facilities where they should absolutely do events or they should absolutely not do events?
You're asking the event queen if there's a time and place when somebody shouldn't do an event. I think if somebody really hates to do an event and it's going to come off with not love, then maybe you should stick away from it. But I started in the treatment industry as an alumni coordinator. And so if you have an addiction treatment program or a behavioral health care program, I think that an alumni program with events is probably one of the most easy to do and most financially rewarding event you could start with.
Well, let's jump into that one as a starter.
Okay.
So, alumni events.
Mm-hmm.
Why should we start doing these? How do we do them? Let's go into it.
Well, in the idea of a social model of recovery, people stay sober and stay healthy with connection and community. And so a lot of times, and not so much as in the past, but in the past, people would travel from all over the country to go to a treatment center. I think it's gone back to more regionalized, which is absolutely, a really great thing. And a lot of times treatment facilities keep people around in sober livings and IOPs after they're done with treatment. And so you have a built-in audience base. And there's nothing better than an alumni who stays sober or a behavioral health client that gets well to be a better reflection on you. And it doesn't just happen in 15, 20, 30 days of treatment. It happens over the course of 6 months, a year, 2 years. And the longer that you can stay with that person, a lot of times, some people who have really strong alumni programs bring those people back into the fold to work.
Mm-hmm. Can you tell a little bit about the types of events you were hosting when you were doing it for that alumni program?
Sure. So one of the good things about alumni that you can always count on is they're always hungry. So bring pizza to the party and you always have people. The very first event that I ever did before I understood alumni, I understood events, was that I had an event, I had a sign-up sheet. I was going to do a neighborhood bicycle tour with lunch. And so I had 35 people sign up that they were going to come. So I ordered 30 bicycles from the rental company. They lined them all up there. So everyone came and grabbed their lunch and then left. And so 3 of us took a bike ride. And so I learned really quickly that first of all, you have to know that not everyone who says they're going to show up is going to show up. And second of all, that just because that didn't work, I didn't lose my optimism about the alumni event. I realized that food was essential, and something that was maybe not quite so risky as getting on a bicycle where you could fall and have to maybe not look so good was probably a great place to start.
So bring food. That's important.
Food is key.
So with alumni events, if you're doing this, how do you reach out to alumni? And I guess I'm asking for, tactics or tips for promoting events.
2 things about the alumni. One thing that I learned at Foundations Recovery Center was that we never mixed the alumni with a business development list. And so if you're thinking about starting an alumni program and thinking that it's business development, it is, but it's not. And so we had our own massive list because every single week I would go into the treatment facility and I would have an hour-long session with people in treatment. And at that point, they would either sign up to be in the alumni program or they wouldn't. And in Montare has been really successful with that same kind of agenda, getting the alumni people go into the treatment centers, because if you get to know the people before they leave treatment, they know who you are. And they could already tell I was a lot of fun. So, when I said we're going to the beach, after I learned that they like food and, party, I filled up 2 buses and took them all down to the beach. And we had like 100 people in Laguna at a beach party. And being that I was a chef, I was cooking hamburgers all day long, but it was a huge success. So I started to see like, wow, this kind of excitement can build upon this excitement. And not everyone made it, but the people who did make it got a lot stronger.
And what kind of success are we talking about with an alumni community event?
So remember, Foundations, if you remember, if any of you are around long enough, know that we had quite a big alumni program. So in any given month, we'd get 30 alumni referrals back into treatment. Wow. Whether it was that they didn't make it the first time, because not everyone makes it the first time. In fact, very few people make it the first time. So you also build that brand loyalty where then people will come back to you for treatment because they already know that they have the support and the love and the system set up in place. But that's like a pretty big ROI to get, 30 alumni referrals in a month. And we're talking about a big system. Because really, if you look at it, who wants to have 30 alumni that have relapsed in a given month? But we're talking, hundreds and hundreds of programs and things around the countryside.
Yeah. When you were hosting these events, was that a goal? Was to get referrals, or how did you kind of set these things up when you pitch the ideas?
Well, the goal with alumni is to get referrals. That's just a wonderful byproduct of that. Every year I would do an alumni retreat, and we'd have like 150 people would come. We had a good budget back then. Budgets have changed over the years, but I rented a hotel. We had pool parties, and we had, an entire series of recovery events for the whole weekend. And 150, I think, is where we maxed out. But that was like, people came from Tennessee and they came from all over the country. And every year they'd come like with another badge of, I've made it another year. And then they would be our speakers. And it really was a really great thing. This past weekend, our Montare alumni coordinator did a small retreat with like 14 people that I got to participate in. And it just is, besides for the benefit financially on the ROI side, to see people recover is why we do it.
Yeah, absolutely. So we've got alumni programs and events for them. What other types of events have you put on, or types of events?
So the one that's really the most popular is, like, there's a lot of lunchtime events, where the issue with those is that they can become social parties. And I think a lot of people around say, oh, look at, they make jokes about BD people. All they do is go out to lunch. And that can be costly. So as a BD manager, when I was a BD director, it would be like, okay, who did you meet? How are you going to follow up with them? And, what came from this lunch? Not just, gee, I had a great taco salad over at, El Ranchito, but what do we do after the business lunch? So that's really the important part, is like, who do you connect with and how do you foster that relationship going forward?
And did you use any advice to folks who are just going to start hosting these things? One, with how to find folks who want to come, but then two, how to make those meaningful connections and then be sure that you're able to follow up afterwards?
One of the things, we're doing a party next week for Phoenix Rising. And what we're trying, and I think this is like a really good novel approach, is we're inviting a select handful of people for an earlier tour and a lunch. And then in the afternoon, we've opened it up to the community, because you don't know who's out in the community and what they're looking for. In the last couple of years, I've always used Eventbrite for years, but in the last couple of years, Eventbrite has taken it to the next level, because if you do an Eventbrite event, you get the people who Eventbrite is marketing to, and if you spend a few dollars of marketing with them, they're going to market your event out. I did a vision board class.
Renee, could you really quickly talk about Eventbrite and what it is, in case
Oh, sure.
someone doesn't know?
Sorry. So Eventbrite is there's plenty of them, but I tend to like Eventbrite because it has longevity, and I kind of like things that have longevity and the marketability of it. So Eventbrite I think it's eventbrite.com. You go over there and you can set up an event. It's free if the event is free. And if you're charging for it, then it's more. And they've actually added a paid amount to email people. And what's really nice about Eventbrite is they have all the marketing tools as part of their platform now. So you can actually connect your Eventbrite event to a Facebook event, which if you're not using Facebook for events, then I suggest or say that you're missing the mark here. So I'll take an Eventbrite and set it up there. So the design is all there. I'll push it out to Facebook, and I have the ability to use the Eventbrite platform to actually have them market an event. And not, some events are private, but more public events. Like, so the lunch we're doing, that's private. If you don't have a link to it, you don't see it, because a lot of people will look for Eventbrite for free lunches. So you want to make sure that you either make it private or an event link. So it has a lot of different controls that you can make with the event. But for an example, like my big Emerging Themes in Behavioral Health Care conference, it reaches people that I might not have reached that could see it. Or it reaches people beyond the behavioral health care scope. This winter, I did a vision board class for our Conscious Health Center, and there were 40 people who came, And not all of them were people I even knew, but it turned out somebody who saw it on Eventbrite worked at another treatment center.
Hmm.
So you don't know who's out there. And the more ways you can reach them, the better, because I think in advertising, it says now you need to reach people 9 times before they act.
Yeah. Multi-touch is necessary with
Mm-hmm.
everybody so distracted and busy with the rest of their lives. This is interesting, kind of talking about the technology that you are using for these events, from Eventbrite to Facebook. Is there any other like can't miss pieces of technology that you find make hosting events or running events or following up after events easier?
Well, hopefully you all have your email platforms. And now, depending on the size of the company you work for, you may not have as access to all the Salesforce information or things like that. But email is still, king, if you want to call it that, because I always talk about Facebook and online platforms as being the park. Everybody's at the park. But when you get them over to your backyard and you're in your Constant Contact or your AWebers or, your HubSpot, whatever you're using, then you can talk to those people. And not only can you talk to them, but you can separate them. So I have lists for people in California, Arizona, Texas, alumni, emerging themes, the conference, even the LGBTQ conference. They're all separated so you're not always hitting everybody for every event.
I like that. So this metaphor of the park is where everyone's hanging out,
Mm-hmm.
but it's really powerful when you're able to get them to your backyard, and you're kind
Mm-hmm.
of comparing that to an email list. So now you own this list of people. You're not renting it or leasing it from one of the big social media platforms, and you can contact them directly with information.
And don't belittle the friends you've made on Facebook and stuff like that. So last night when I took an event live to Facebook, it said, "Who do you want to invite?" And so when I went down my list of friends, it has all the people from all the addiction groups I belong to, all the addiction things that I've been to. And so I was able to target another 150 people who have just become friends over the years that I probably wouldn't have thought to, on my phone send the event to, because I also use the phone as a way to follow up as one of those touch points. Whenever we make a social graphic now, and I highly recommend people have Canva accounts, that you can then, download it for your phone. You can use it for your Eventbrite. You can use it for your Constant Contact, so that your event starts to look the same no matter where, and hopefully aligned with the brand of the business that you're representing.
I love it. And a great call out for Canva. Super easy to use, often free for the amount of for how you will be using it. Great graphic design platform. Definitely recommend checking that out. I love that, because you are such a good marketer, you have all of these tips and tricks and tech that you're using and experimenting with all the time. That's really good for people to hear. So we're thinking about events. We've talked about some alumni events. We've talked about lunches for more BD. What other big types of events have you seen a lot of success, either with getting the name of the treatment center out there, or actually acquiring new patients, or just celebrating and recognizing the good work that people have done? What other types of events have you put on?
I think CE events are something that are really important if you have a program with a clinical program, because it's a way that you can feature your doctors, your clinicians, and I say use your own clinicians and your own doctors. And it's not an inexpensive way to get people, but you can get anywhere from 100 to 2,000 names on that email list that you're taking people out of the park with a good clinical talk. I think a couple of years ago, I did one on, we had a doctor who was overseeing the ketamine clinic, and hundreds of people from all over the country signed up because it's a safe place to learn about something that they probably had heard about, but they weren't really ready to jump into, and it was coming from an MD, so there was some benefit to it. I think that's
And,
a really good way.
and running CE events, what's the benefit to a treatment facility of collecting that type of a list of people?
Lots of different things, because you become a recognized leader for your clinical programs. Because a CE event's not the easiest thing to do. You have to have a CE provider. One that I really work with a lot is CE Go. And because they have a good clinical reputation, they have a really good platform, and but it's not inexpensive. So if you do a CE event, you're really looking at about $1,000 to really to pull that off. And you have to make sure that there's a good ROI on it. Like one time, my the CEO said, "I want you to do an event with doctors, and let's have it at the Ritz-Carlton." And at the time, I was like a deer in the headlights, because everyone knows doctors are impossible to get at events, right? And here he wanted to spend all the big bucks at the Ritz-Carlton, and we got a speaker from UCLA, and I think I had 2 doctors sitting in the audience of about 60 people, and the CMEs. If you think the CEs are expensive, CMEs are even more expensive, and there wasn't a really good return on it, and I've learned over the years that you need to come up with a better plan to have doctors. So at the Emerging Themes event, I always have a doctor's dinner. And last year we had 30 people in the room, and 23 of them were PhDs and higher. And this year it's already sold out for this event. And we created a little niche around it. And I wanted to do some pop-up dinners with doctors and things like that. Now, a lot of you don't need to reach out to doctors, because really, are doctors doing the referrals? Probably not. It's probably the receptionists and the people in the office who make more of the referrals than the doctors themselves. But it also is really good at a conference to maintain that level, that I have a lot of MDs coming for CMEs and things like that. But that's just me being a snob.
No, I was just going to ask to really clarify the benefit of these CE events. Obviously you're handing out continuing education credits to folks who are in attendance, but you are also putting your brand kind of on the map for its clinical program. And I think that the long tail outcome of this is that the folks attending now recognize you as being a place where they would seriously consider referring folks out to. Is that one of the outcomes here?
Yes. And if you think about it, now we're talking about CEs for therapists, LCSWs, that kind of, but if you have a treatment center, an alcoholic treatment, more like an alcohol and drug treatment center, you might want to think of what you use for KDAC certificates, because you might be better off having, an event where the drug and alcohol counselors are going to get CEs for that. So it all depends on who your audience is. So in behavioral health, you're probably looking for a therapist, but in addiction treatment, you're looking for people who it's a different audience.
Yeah. I love this idea because, we started talking about the overlap with BD and marketing, and how if you get these folks kind of working together, this seems like a total slam dunk for the marketing team to really help BD out with, maintain or develop new relationships for referrals.
Again, that's really true. And there has to be the business development director, or the person who is, because one time I had a list of 1,000 people, and I divided it between 5 or 6 BD people. And unless I'm the person who's saying, how'd you follow up? What did you do? What are the contacts you made? Then it loses its power and it loses its steam right there. And that happens a lot with the emerging themes or any conferences. what is, my boss wants to know, how many referrals did we get from that?
Right. So you're just saying there is a moment in time shortly after this event where you really do need to follow up, or you kind of lose the momentum from the event, losing the enthusiasm from the event.
Right. And that takes a really good person to know your timing. Like, I don't know how many times I've been home from a conference, not even a few hours, and somebody's already following up with me. And it's like, hey, read the room. I just got home. I really call me in a week, or, was I even interested in what you were selling? And I think that sometimes, like, if you go to a conference, you see people like pulling all these cards. Better off you should get 3 cards that are going to bring you business than 100 cards to add to your email list, unless you're doing events and you think that it's going to be beneficial somehow.
Yeah. That's pretty funny, especially if you're at some national conference and everyone just got home and there was thunderstorms across the country and their
Oh,
flights were delayed. The last thing they need to hear about is some outreach. Hey.
and you know what happens because you were at that conference too.
Yeah. Yeah, that's a great call out. All right, so we've gone through alumni, we've gone through kind of these lunches, we've gone through CE classes. Any other type of event that you are pretty keen on for patient acquisition, or any of the other outcomes we've talked about?
Well, of course, I've done several major national conferences, and I was part of the foundation's conference that took place in San Diego and also at the Breakers. And in the day, those were some amazing conferences. And I know the West Coast Symposium, is another, it's like a beady extravaganza, and there's education too. A conference can put a company on the map, but it's not a free way to put a company on the map. So when I created the brand for Montare, and actually created it from the design into being, they wanted a conference. And I thought, like, well, let's put us on the map with something that was significant and comparable to an East Coast conference, something where the clinical was superior and, the marketing supported it, but that it was really a clinical based conference. Now, we've done it for 4 years and it hasn't really broken even yet, because, before you get into this, understand, like, a hotel's going to get their $100,000 or more. So you have to be really, really well funded for that kind of a thing. But what you could, if you really wanted to do some kind of a conference and you really wanted it to, break even and pay for itself, first of all, it's not going to probably happen the first year, and it has to be a long game, but start with a day-long event. So there's some really good, significant day-long events that are, just for a day. So people might get, 4 or 5 CEs, but they're still not going to be an inexpensive way to go, because not only do you need the CE team, you need the marketing team, you need like a vision, and you need the business development people selling the exhibits. And so it's a big enterprise to do. It's
Right.
not the easiest way to network.
When does it make sense beyond budget? Like, do you have to have a national footprint to be launching some of these day-long conferences, or does it not make sense for everybody?
Well, first of all, you have to have somebody who's enthusiastic about doing it.
Yeah.
And you have to have an idea and something to present. And it doesn't need to be a national thing, because it's really great to have like a Southern California one, or a South Florida one, or, something where people can come together in small, even 50 people for a day can be a really significant event. One of the events like that is Carol Teitelbaum has been doing this conference called It Happens to Boys for, I don't know, 10, 15 years. Every single year she's done it. And some years it's been full of young people in addiction. And this year it seemed to be a lot of people from Southern California who came together, and her perseverance around it is pretty spectacular to watch. And she has a vision, like she's so driven about young boys who have been abused and what it does towards the rest of their lives, that this dream has been carried by her and her group for a long, long time. So you either have to have that kind of heart about something, or you have to really have an intended purpose.
That makes sense. Have a good reason for doing this beyond just immediate results, because it sounds like for most part, a lot of these events, the results aren't going to be immediate, at least the ones that may prove ROI, but you get a lot of different types of results. You get people who are coming together, sharing their passions, friends meeting friends, and that's worth it in its own way. Yeah.
Mm-hmm. Absolutely.
So now we've got the bigger events, we've got alumni, we've got some BD events. I'm just really curious about how to figure out how many events should I have, and how do I pay for all of this? Like, what budget are we actually expecting for some of these things?
It could be an event when you go visit someone. So if we just talk about like an event, like, meeting somebody at their office and bringing them a cookie is an event. Mm-hmm. And I think those kind of events are overlooked because, now we have these Zoom calls and things like that. But one of the women that I worked with recently made these door hangers. While you were out, I came to visit. I mean, because we don't visit anymore, visiting could be a really inexpensive, great event. And I think that's one that's really overlooked. Or going, because they don't all have to be really expensive. Mm-hmm. Like this weekend, the alumni event, we happened to have the space where people could stay, which not everyone has. But one of our cooks actually did the cooking for the entire event, gave her a few extra dollars and things like that. And a lot of the purveyors that we already work with on site came in and taught. So there's this idea of, we can't afford it, but you can get more clever. So I think sometimes it's about empowering our staff to go further and become really a part of that. Marketing isn't a business development job, but it's a team effort. And how do we bring that pride back into everything that we do?
Yeah, I love that. Marketing is kind of the job of every single person who works at a addiction treatment facility. Even if it's not in their job title, it's the interactions that you have with people on the phone that's kind of marketing, and it helps spread awareness of who you are and what you stand for. So that's a really great call out. How do you like promoting events, especially kind of community events? Are you using digital? Are you outside on bulletin boards? What's worked for you?
I think now we're doing it, and this isn't another one that business development can be involved with, is employee events. So the team spirit of that, with the idea that everybody is the best marketer your company has, we're doing an event with a magician. And so I sent out an email and to the whole team, and 20% of them might open it and the rest thought it was spam. And so they're like, well, how do we reach these people? So they're using WhatsApp chat, and they're also using the time clocks that are on the walls. So they're like, okay, I hear that. And so I made, flyers that I could hang by the wall, and I made a digital piece that could go on the WhatsApp chat. Remember, even in your company, 7 to 9 times. It's not just out there, it's everywhere.
Gosh, isn't that true? You got to hound people down, even if they're rubbing shoulders with you every single day.
Exactly.
Yeah.
I mean, it just goes to show you, because one of the people that I gave one of the digital things to, in the morning when she just went house to house, she got 20 RSVPs for the mentalist. And I'm thinking like, okay, so if one way is not working, it doesn't mean you have a bad event. It means you are not reaching the people you need to reach.
Yeah. Let's talk about bad events. I'm sure there how to avoid them, more importantly. So, do you have any kind of quick bullet points of the biggest mistakes you see with people who are running events?
I think you should always know what you are hoping to get from the event before you even put it down onto paper. And, how you're going to get the right people there at that event is secondary to that the bigger, broader vision. So say you have, for an example, say your budget for events is $1,000 for the year. Just that's not really a big budget, but like, how are you going to spread that out? So think about, like, are you going to, blow your whole wad in one event, or are you going to, what's the best way that I can get people? Because not all events have to cost money. Like one time when I was up in Seattle, I wanted to meet some addiction people, and we went out to lunch, and I think we all paid separately actually. And then we took a walk. And that I really got to know these other women, and I know what they're, even though we may or may not have done much business afterwards, I know that they're up there, and I've called them several times when I've had clients looking in Washington. So if it's thinking, oh, I don't have the budget for it, then take a walk.
I like that. That sounds like a lovely thing for me too.
I think the biggest mistake people make is just thinking because everybody's there that it's a useful event.
Tell me more about that. So just because it's well attended,
right?
Don't think it's a success. Why not?
Well, because like I have somebody who's been a long-standing business development person who puts maybe 14 people a month into treatment. And I'll say, hey, are you going to that event? No, it's just a bunch of BD people talking BD, nonsense. And instead, he'll spend his day making appointments to go take one therapist out to lunch. And so, yes, there's been a lot that BD to BD business, but that's not the long-standing way to grow your own business. I know that one of the events that one of the most successful business development persons I know, she does hospital visits. And I've done some of those where you actually take the caseworkers lunch, or the caseworkers some swag, or the caseworkers, because that takes you a longer time to get in with the hospital and those kind of things. It's not a one and done. But the thing with the caseworkers is you have to know what they need. And so for caseworkers in a hospital, they need you to be the one call they make. So how do you become that one call that they make? Well, you find placements for the other calls that they couldn't place. But trust me, everyone's trying to get in for those. So like you might be on the schedule to deliver one lunch in 3 months to the hospital caseworkers, but how are you going to make it count?
Yeah, how would you make those type of events count?
Well, for me, I don't think you can meet a whole room full of people all at once. So I've always been the type of person to spot two people in the room who needed to know each other and introduce them. And I become the networker of those people. And so one time I lucked out at the hospital, and the woman called me for something. And I made a point that I wasn't too busy to do it. And so then she started calling me for other things. And, in business development, you might get 7 or 8, 10 calls before you can accept that one admission. So it is good to know all of those other people that you can send to. But again, you can't send to everyone. So you're going to find that the people who are reciprocal and who have the programs that you want are the same people that you're going to want to spend more event time with as well.
What would you say is one of the most successful events that you've run or seen run in your career as far as patient acquisition goes?
Oh, that's a hard one. Um, Alumni events.
Yeah, alumni events with that big.
Alumni events are by far are the biggest payback.
Yeah. You think even better than getting that lunch meeting in at a hospital?
It all depends on your own particular program. Like, what contracts are you in? Like, so if you're a completely out of network company, going and spending a lot of time at the hospital is just going to give you a lot of busy work. But if you're a company that has a lot of in-network then and you can place a lot of people, those hospital contacts are going to be really beneficial. So if you're an out-of-network company, the events you're going to do are a little bit more creative. One of the clever BD people I worked with, like when she went to an event in Colorado, she took a hand-selected 10 people to the baseball game. And because, again, people do business with friends. And so the thing that I started when I first got into treatment was, I think I did one of the very first addiction treatment golf tournaments. And at the time, my boss is like, people in addiction, they don't golf. And they're like, well, let's just try it out. Again, 150 people at my golf tournament. And then next thing, now every conference and everyone has a golf tournament. But when I started, 12, 13 years ago, golfing and addiction treatment were not synonymous. Now there's this whole group of men that I know who do business through golfing. And they have a really tight network. And if you could get in and golf with them, you might get some business.
Yeah. We were just at TCIV East. Starts with the golf tournament. We're hosting an event this summer here in Madison, Wisconsin. Starts with the golf tournament. So if that was the ball is still rolling.
I look at, my contributions. I was telling someone recently, hey, some of my contributions is I did the first golf tournament and like that first big alumni event, and a lot of them first, because when I got to addiction treatment, I came as a caterer, as a chef, and like up-leveled the whole game. And then to see like this next level, because a lot of the people who are at my golf tournament now are running like the ski events in Colorado. And I just smile because I know they were just out of treatment when they used to come to my golf tournament. And it's like, it's really a nice thing to see how it's leveled up over the years.
Yeah. There's a couple of people who have started to have pickleball tournaments for their events. I'm hoping that catches on. That would be a lot of fun.
Yes, that would be. See, now there's a good start. Like if you could get pickleball tournaments from, the Southeast to go against the Midwest, to go against, and then really bring them together at one of the national conferences, I think that could be a really good draw.
Yeah, now we're talking. Renee, you are up to so many things. I think you're an author. Tell us a little bit about that and what's going on in your life.
So it's really all of the same. If a book event is similar to any of the other events, but I'm really excited about my new book. It's called A Pilgrim's Guide to Walking Wisdom. And it's about walking and walking wisdom and the mindfulness of walking. And in it is 11 great insights that I've learned over 37 years of recovery. And this past weekend at that alumni event I mentioned earlier, I actually got to work with alumni and take them on a walk. So the new event that's in my dreams is creating walking communities across the country who will use these 11 insights as a weekly walking meditation and motivation. I have worksheets with it, and I'm very excited about it.
That's awesome. Where can folks find this book if they wanted to take a look?
So the book's on Amazon. It was a number one bestseller in travel, Spain and Portugal, or my website's thepracticalshaman.com. If you see me at some of the events coming up, there's the WAP meeting kinds of events. Oh, that's another one we didn't talk about, like associations.
Yeah, let's talk about it.
If you don't have an association in your hood, you should start one. Like there's the woman in addiction treatment, and then there's the men in addiction treatment. And and my friend Monica started her own, where that people come together around something as a networking thing. So if there's not something already that you have, then by all means create one, because again, you build your own foundation of workers. And the reason I said that is I will be presenting at one of the WAP meetings and hopefully, around the country with this idea in the future.
Yeah. And you've got a huge event coming up in about a month. Tell us about that.
Yeah, this might air after the event, but Emerging Themes in Behavioral Health is at UCLA from the end of April, and it's the 4th annual conference. And we've gotten a lot of support from UCLA for this in terms of the level of presenters. If my dream a few years ago was to build the Harvard conference on the West Coast, I think we've done it. And the level of the information, and we've kept it behavioral health as opposed to addiction. And I get a lot of speaker applications for addiction, but there's plenty of conferences on addiction. But this is primarily about how do we bring together new, innovative information about behavioral health, which is really growing and changing. And this conference brings about maybe 400 people together, which is small by some conferences, but it's mighty.
Yeah, I love that. All right, Renee, anything else about events that we didn't talk about or didn't get a chance to say?
Remember, always have food, whether it's a cookie with your logo on it, and there's a lot of people now who make those, and to really make sure that it's branded and that people know what it's for and how to contact you. If there's no sense of inviting 10 people over for dinner, if there's not a follow through and a way to follow up with them. And that call, I remember years ago in AA, they would talk about that picking up the phone is the hardest thing to do. And the more you know something or somebody, the easier it is to do, because you can call and actually talk to them about things. And I think events do that. They bring the human side to the business relationship.
It's a wonderful way to end. All right, Renee, thank you so much for your time. Really appreciate it.
And thank you for having me. And I look forward to meeting all of you at one event or another.
Absolutely. That's today's episode. Thanks for listening to Recovery Reach. We'll see you again next week. And remember, the more people you reach, the more you can help.